Welcome to the Aced It podcast, where we turn science into sense. In this very special season funded by the Bureau of Justice Assistance, we provide 10 timely episodes with the hopes of helping listeners understand what we can learn from current research that will help correctional staff. And please note, we did not just guess at what correctional staff need to know. We traveled the country, interviewing individuals working in prisons and jails, and the topics of these episodes are exactly what they asked for. So, I'm Danielle Rudes, your host, and here we go. As we focus on some of the most pressing issues pertaining to health and wellness in custodial institutions, it is important that we discuss a concern that we believe is imperative to the safety of prison and jail staff and residents. In this episode, we discuss several pressing issues surrounding substance use in prison and jail. Specifically, this episode provides you, the listener, with some emerging and important information about 1, the risks and implications of fentanyl, 2, what we currently know about the drug called K2, aka spice or deuce, and 3, how effective randomized drug testing is within correctional environments. By no means will this provide you everything you need in terms of knowledge, but it's a good starting place. During interviews with nearly 200 prison and jail staff during my team's study all across the United States, these 3 topics were a frequent source of conversation. Staff often expressed a desire for additional training and/or resources to help them deal with substance use challenges among residents more effectively. It was clear to us as a research team that there was limited understanding among the staff and a good deal of uncertainty regarding substances and substance use challenges behind carceral walls. So, in this episode, I provide an overview of some findings from recent scientific research that hopefully will begin to shed light into these dark corners and help prison and jail staff learn more so that they can do more, both safely and effectively. First, in a 2019 article written by Bucerius and Haggerty entitled Fentanyl Behind Bars, The Implications of Synthetic Opiates for Prisoners and Correctional Officers, the researchers examined the implications of fentanyl in prison, that is, the effects fentanyl has on the carceral environment. Fentanyl, a synthetic opioid, has been known to be incredibly dangerous, in fact, lethal, and is reported to be 100 times more potent than morphine. In addition, its derivative, carfentanil, is 10,000 times more potent than morphine and often used as the means to tranquilize large animals. The intense potency of fentanyl and carfentanil has led to individuals buying what is known as a buffed substance, a drug that is mixed with another substance to produce a high, and because it is cut with cheaper ingredients, it comes with an inexpensive price tag. The concoctions include fentanyl and carfentanil mixed with baby powder, powdered sugar, or even other drugs. It makes it nearly impossible for the individuals using the substance to tell exactly what they are consuming. Carceral settings generally house a fairly large number of individuals who have or have once had a history of substance use. This makes the emergence of a new and dangerous drug, such as fentanyl, a huge safety risk to those living and working inside. In the study by Bucerius and Haggerty, they conducted semi-structured interviews with over 580 incarcerated residents and 131 correctional officers in Western Canadian provincial prisons. Through these interviews, they aimed to explain or examine 2 objectives. 1, how has fentanyl shaped the prison experience for those incarcerated? And 2, have the opioids altered the job of correctional officers? Here's what they found. There has been an increased number of overdose in the prison units due to fentanyl. Residents reported that over 85% of the individuals in prison have a substance use issue, and over 75% of residents reported they knew someone who had overdosed while in prison. In addition, they found that a big portion of fentanyl use by residents within the 4 prisons in their study was unintentional. The cutting of other drugs has led to people accidentally ingesting fentanyl because they thought it was something else. This has led residents to become more aware of their quote-unquote normal practices in prison. More specifically, some residents stated they would not consume any food that is not prepackaged as they worried that fentanyl and carfentanil has become a form of weaponization within prisons, leading to mistrust. The rise of fentanyl combined with this lack of trust has affected correctional officers too. Bucerius and Haggerty's data supports that there is an increased fear among correctional officers regarding the risk of inadvertent exposure and becoming a victim of targeted poisoning. This fear alters many correctional officers' attitudes and commitment to corrections as a career. Although we do not know the likelihood that these fears will become a reality for correctional officers, we do know that the rise of fentanyl has slightly reduced officers' willingness to search residents' cells without proper protection. Consequently, this may lead to delays among correctional officers when responding to possible resident overdose situations. Bucerius and Haggerty urge that correctional officers should go through adequate training on fentanyl, specifically on fentanyl, and how to avoid inadvertent exposures. They hope that sharing the right information will ease the fears some correctional officers have and possibly help to avoid any collateral consequences. Similarly, my team's research showed that information and training for correctional staff on both fentanyl and the drug known as K2, spice, or deuce was also extremely limited, and correctional officers and residents both noted this. K2 is a synthetic cannabinoid emerging rapidly worldwide, but because it is manufactured in hundreds of different concoctions and it is created by soaking paper in the liquid K2, it is fairly easy to get in carceral settings. The dosage each person ingests is virtually unknown, and both the short and long-term effects are largely or understudied. This leaves correctional staff uncertain of what exactly they are dealing with. This brings us to study 2 for this episode. In this study, Oliveira and colleagues in 2023 conducted a systematic review to uncover vital information behind the toxicity and effects of K2 or spice. Synthetic cannabinoids, referred to as SCs sometimes, have been labeled as new psychoactive substances. Initially, they were created for research. These substances have now become incredibly popular as individuals started using them as a substitute for cannabis, marijuana, and to avoid setting off detection through a standard drug test. Oliveira and colleagues selected 64 articles that reported toxicity effects of synthetic cannabinoids in humans, which consisted of 10 clinical studies and 54 case study reports. Of those 10 clinical studies, 359 patients were assessed, and of the 54 clinical reports, 234 patients were assessed. Their subjects were identified as recreational users, 34% of them meeting the criteria for a cannabis use disorder. The results revealed more than 20 different types of cannabinoids, with various toxicologic effects, including seizures, anxiety, paranoia, delirium, psychosis, mood swings, and 25 other reported effects. In addition to this, 26.1% of clinical reports detailed fatal intoxication of synthetic cannabinoids. Scary, isn't it? Much of what someone will experience while on synthetic cannabinoids mimic psychedelic effects, photocannabinoids, and THC, delta-9 tetrahydrocannabinol. Synthetic cannabinoids also have a toxicology profile that is fairly similar to synthetic opioids, like carfentanil, as previously discussed. Synthetic cannabinoids are also reported to be incredibly harmful to those who suffer from epilepsy and schizophrenia, as synthetic cannabinoids heighten the risk of neurological and psychiatric disorders. However, synthetic cannabinoids are widely under-researched in psychological severity and duration. Oliveira and colleagues believe that further research that explores the potential harms of K2 or spice is imperative. And we agree. Not only will the continuation of research pertaining to K2 and spice help advance the field of medicine, we believe it'll also be incredibly important to the field of corrections, as correctional staff begin to brainstorm informative trainings and policies that will tackle the use of K2 or spice in carceral settings. Okay, short caveat here. Well, it's an apology. I wish I knew more. I wish I could tell you more, but rigorous science takes time. And if you're working in corrections right now, please know that my team and many other research teams hear you, and we are on it. Finally, the third study, I'll overview in this episode examines the use of drug testing in prisons. Specifically, it asks, does the use of increased random drug testing help lower substance use in residents and/or increase prison safety? Well, Nguyen and colleagues, 2021, set out to answer this question. Although so far in this episode, we focus solely on discussing fentanyl and K2 as substances used in prison or jail, there are various other illicit drugs available and used within carceral settings. One of the most common strategies used among prisons to deter drugs is through the use of randomized drug testing, specifically via urinalysis, to deter individuals from using drugs. The use of random drug testing is relatively costly to institutional budgets, and the article I present in this episode by Nguyen and colleagues reports drug testing is roughly, quote, 2 times the cost of drug treatment and reduction programs, unquote. The study done by Nguyen and colleagues utilized data from Pennsylvania state prisons over a 45-month period, focusing on the impact of randomized urinalysis on drug use and other misconduct that may be linked to drug use, like hospitalization and assault. However, their results show that a higher level of randomized drug testing in prison did not yield more positive drug tests, and lower rates of testing did not have an overall negative effect. Although the theory of deterrence would suggest that, in this case, the more individuals are drug tested, the less likely they are to engage in those drugs due to the increased certainty of being caught. However, it is far more complicated than that, as the perception of detection by individuals in prisons can be indirectly manipulated by the environment. For example, an individual will only be deterred by policies they are aware of. This makes it highly unlikely that all residents of any prison would be able to fully assess the risk of detection based on the lack of knowledge of policy implementation and changes within the prison. Nguyen and colleagues found that increased drug testing does not appear to deter drug use or any other misconduct linked to drug use. Therefore, the allocation of money used for randomized testing in prison may be best suited elsewhere. The study authors encourage correctional administrators to identify alternative options to effectively handle drugs within prisons. That is, if drug testing is not a deterrent, why not go at the problem a different way? Redirect the money that's being spent on drug testing toward programming and treatment, perhaps. In another episode this season, we focus on medication-assisted treatment, MAT, or medications for opioid use disorder, MOUD. The evidence on those treatments is robust and positive. So those types of problems would be a much smarter way to spend limited dollars with the potential to do the most good. Again, we know a 15-minute or so podcast is not going to answer all your questions, nor will it solve the challenges facing correctional staff regarding substance use in prison and jail. However, by sharing this emergent and ever-growing knowledge with you about the risks of synthetic opioids like fentanyl and the emergence and pending dominance of the drug K2, and the ineffectiveness of randomized drug testing in prisons and jails, we hope we've provided a springboard for you for your continued learning so that we and you can create an environment that places the wellness and safety of incarcerated residents and correctional staff as a primary and critical goal, a goal that is definitely worth fighting for. Thank you for listening to the ASTIP podcast. We love hearing from you. So if you have comments, topics to suggest, or some research you'd like us to cover in a future season, please write to me, Danielle Rudes, at Sam Houston State University. My email is drudes@shsu.edu. And now, a whole bunch of thank yous. First, this project was supported by a grant 5PBJA 22AG00031 MUMU, awarded by the Bureau of Justice Assistance. The Bureau of Justice Assistance is a component of the Office of Justice Programs, which also includes the Bureau of Justice Statistics, the National Institute of Justice, the Office of Juvenile Justice and Delinquency Prevention, the Office for Victims of Crime, and the Office of Sex Offender Sentencing, Monitoring, Apprehending, Registering, and Tracking. Points of view or opinions in this podcast are those of the host and the research team, and do not necessarily represent the official position or policies of the U.S. Department of Justice. Then, more thank yous. Thank you to the Justice Community Opioid Innovation Network, or JCOIN's, Coordination and Translation Center, funded by the National Institute on Drug Abuse, housed at George Mason University, where this podcast originated. Thank you to our fabulous scriptwriter, SHSU master student Jalen Magana, and to my amazing research team at both Sam Houston State University and George Mason University. The team includes Bryce Kuchmarek-McCune, Sydney Engel, Caitlin Bauer, Shalom Aganaya, Alexa Mata, Chelsea Narvi, Alyssa Toman, Miltonette Craig, and Wyatt Brown. And a huge and heartfelt thank you to Jason Luton and the team at Slonky LLC for their fabulous podcast production. Tune in again soon for another episode of Aced It.